Now from CBS 2 News, this is a special report.
So much in particular. The challenge has been so great, and on top of it, there's been so much confusion because no one anywhere still fully understands this disease that's afflicted us. So we're all trying to make sense of that, and we're all looking for anything that's clear and concrete in the midst of this fight, in the midst of this painful crisis. So I want to offer something today that's just crystal clear, and this is about how your city will approach this crisis, how we will approach making sure that we do the things that matter most for New Yorkers. And it's often said that a budget is a statement of values. So I want to be very, very clear about the values that I'm bringing to this process, this entire administration is bringing to this process. And it really comes down to four things. There are four things that we will focus on, four things that I care about profoundly as we fight this battle, four things that we will prioritize in the way we spend our resources. First of all, keeping New Yorkers healthy. Number one job, keeping New Yorkers healthy. Second, keeping you safe. Third, making sure there's food on your table. Fourth, keeping a roof over your head. These are the basics. These are just fundamental basics. And look, even just weeks ago, we have been trying to talk about a lot of other things. We've been thinking about a lot of other things. Our lives have changed just so profoundly in very, very little time. But these four things are what people are overwhelmingly focused on, rightfully so. And your government needs to be focused on these four things too. So things that might have been a priority, 2 months ago, 3 months ago, can't be a priority right now. Things that we would love to focus on in peacetime, we don't get to focus on in wartime, and this, in effect, is wartime. But what I can tell you is these four things, we will spare no expense. We'll spare no effort. Whatever it takes to keep New Yorkers healthy, we'll do it. To keep you safe, we'll do it. To make sure you have enough food to eat, to make sure you have a roof over your head, whatever it takes, we will protect you. And that's going to be clear in this presentation I make today and everything we do thereafter when it comes to the city budget, which will be finalized in June. Whatever we do is going to follow these four priorities. Now, let's be clear, because we're going to talk today about what we need our federal government to do for us to help us make sure we can protect all New Yorkers. If the federal government fails us in our hour of need, then these four things that we must do get harder and harder to do. If the federal government fails us, then I want to be really clear. The notion of this city recovering, it doesn't work if we can't do the basics. Everyone wants a restart. Everyone wants our economy to recover. I know everyone in Washington feels that too. But there has to be a really clear understanding. If we can't provide the basics for our people, then you can kiss your recovery goodbye. It's as blunt as that. The only way you have recovery is if places like New York City in particular, the great economic leader and engine of this nation, if we're strong, our nation can be strong. If we are not strong, if our people are not safe, then this nation can't recover. And that's true for cities and states all over the country. So as this debate starts raging in Washington, D.C., I would ask the President and Leader McConnell in particular in the Senate to remember the first thing you should be thinking about is the human cost, the moral question. What should we be doing for our people? What should we be doing for our fellow Americans who are New Yorkers and Americans everywhere to protect their health, their safety, the ability to put food on the table and a roof over their head? That should be the moral question. That should be the straightforward question. But if they need somehow a pragmatic motivation. If they need a motivation that's about the economy or the restart, then I offer this. If you don't do those basics right, you won't get your restart. So why don't we do it now? Why don't we help people right now? Why don't we make sure that these basics are there for every New Yorker, every American, so we can move forward together? When you think about what we've had to do over the last weeks, and it feels like it's been months or years, but it's really only been weeks. We had to shut down our retail stores. We had to shut down bars and restaurants. We had to change our life fundamentally in a city that's so famous for all that, all gone, all altered profoundly. We had to close our schools, that painful choice, which has meant such challenge for our families, for our children. And we had to go to shelter in place and social distancing, a way that would have been unimaginable just weeks ago. We made these decisions. I made them. New Yorkers made them too, by taking these new rules and living by them. And again, you've been absolutely outstanding in your adherence to these new standards. We made these decisions. They were the right decisions. It was all about keeping people healthy and safe. But it was impossible to ignore at the time those decisions were being considered. It was impossible to ignore all the other impact it would have on people's lives. The fact that these decisions would mean a lot of people would lose their livelihood, and we didn't know for how long. The fact that our economy would be set back profoundly. That would mean we would have a lot less to work with. We would have a lot less revenue as well to serve our people with. But again, we put the priority on your health and your safety. And now, as we're feeling the effects of this crisis, those decisions we had to make, but it all comes back to the sheer ferociousness of this disease, the worst healthcare crisis in a century. Now we have to do everything we possibly can to make sure that people are safe and to protect them in all the ways I've outlined. And that's what this budget is all about. Now, over the last 6 years, we talked frequently about preparing for a rainy day. We got much more than a rainy day. We got a pandemic. We got something unimaginable. I've been in many meetings where there was discussion of preparing for a recession. There was discussion of preparing for hurricanes and blizzards, all sorts of challenges. No one foresaw a pandemic of the extent of this, something we haven't seen in a century on this earth. But getting ready for a rainy day still helped us because we had created profound reserves. And we'll talk about that. We've had, right before this horrible disease struck us, the highest fiscal reserves in the history of New York City, and thank God we did. And that work happened over the last 6 years, and with the great partnership of the City Council that was very devoted to that process of ensuring we had ever-growing reserves. The extent of the problem, however, so unprecedented, is such that it immediately makes clear getting out of this problem will take solutions unlike any we've seen before. They must come from Washington. This is just the honest truth. We will do our share, as we are going to see today, over $2 billion in very tough budget cuts, very unfortunate budget cuts, but they had to be done. We're taking the actions that we can take. But the only force that can ensure that we get through this the right way is the federal government. They have the ability to provide the resources in a way that no one else, no organization, nothing else on earth can help us the way the federal government can. And now it's their hour of decision. We had those great reserves, and you'll see today they have been deeply affected by this crisis. We have been making cuts, and those cuts are painful, but they pale in comparison to the challenges ahead. And this is not a solution going forward to cut your way out of this crisis. If you cut your way out of this crisis, it comes at a huge cost in terms of our ability to provide for those four basic things all New Yorkers need. Let's be very clear. If we don't have the resources to ensure people's health and safety, their housing, their food, this becomes a very different city. We have to make sure those basics are there for people. So where we can cut, we will, but when it comes to protecting New Yorkers, we will not cut that. Now, the backdrop here is painful, the loss of the revenue we need to protect our people. Sales taxes are way down because people aren't going out and they're not buying things. Income tax, obviously way down. People have lost jobs, lost income. We believe, based on the kind of careful forecasting that our Office of Management and Budget does every year, that right now, this is a horrible figure, and I'm very sorry I have to tell you this, but over this current fiscal year and next, we will lose $7.4 billion in tax revenue. That's today's estimate. We don't know what the future brings, but that's what we know right now, and that's a horrifying figure. And on top of that, we have a lot of new things that we have to do and costs we have to incur to protect people. There are huge new costs in terms of our hospital system, medical personnel, supplies to save lives. This all must be a priority, and we're spending whatever it takes to make sure people are protected. Food, we talked about this yesterday, $170 million in new spending to make sure that New Yorkers have enough to eat, because we now have to ask that question. How many more families won't have enough to eat in this crisis? We have to protect them. And we don't know when this crisis ends. We do know it will end. That much we can say, thank God. But we don't know when. We don't know how. And we know that the impact that's been made on people continues to grow, and we know that the loss of revenue could be even greater. So it's a very sobering situation. But we keep coming back to those basics. That's what's going to guide us. The executive budget I'm presenting today was built for this moment in history, and a moment unlike any other, literally. The budget totals $89.3 billion for fiscal year 21. It is balanced, again, focuses on four things overwhelmingly: health, safety, food, shelter. That simple: health, safety, food, shelter. As I said, we found ways to save. We found cuts we could make, even if we didn't feel anything but pain in taking away some of these things. $2 billion plus in cuts through our PEG program. That's mandating that agencies find cuts to their spending. Additional almost $700 million in other savings we found, so a total of $2.7 billion in savings across both fiscal year 20 and fiscal year 21. And there will certainly be more tough choices ahead. And to get us through this immediate phase, we are drawing down on our budget reserves. We built them up. We hoped this day would never come, but it has. Thank God those reserves were carefully built. They will now help us get through. If ever there was a time to draw on reserves, it's now. And on top of all the challenges brought to us by the coronavirus directly, that are part of why we have to draw on those reserves, there's yet another challenge, what we've seen already in cuts from the state of New York. $800 million already, and we obviously are watching carefully because we have to be ready for what the future brings in terms of the state budget. Now, the one way that you can get out of this without causing immense human pain and setting back our recovery, the one way is to get the kind of direct federal aid that we deserve. No New Yorker is responsible for this horrible crisis, but New York has borne the brunt. We have been the epicenter. When you look at the impact here, anybody with a heart would recognize that the federal government has to come to the rescue. We lead the nation's economy. We're the biggest city in the country. We constantly send resources out to the rest of the country year after year. There are so many reasons why it's clear, but just humanly, this is the reason that should matter the most, because people are suffering, because no Americans should have to go through what New York is going through, and the federal government should be there for us. I remind you, the federal government was very quick to bail out the banks a decade ago. No questions asked. The federal government was very quick to bail out the auto industry. How about bailing out the nation's largest city? How about bailing out the epicenter of this crisis where people have been suffering? That is what our federal government should do for every reason, morally, practically, as any question of fairness, as any question of how we move forward. And we're still waiting. Now, what we're going through is what other cities are more and more going through, other states are going through. We're not alone. They haven't seen the help they deserve either. There's been $2.2 trillion in stimulus funding so far. $2.2 trillion, of which only $1.4 billion has been in direct aid to New York City. To give you a comparison, we got $1.4 billion, and we're the epicenter of the crisis, 8.6 million people. The airline industry got $58 billion. So corporate bailouts, huge. But a bailout for the place that needs it most has been minimal. I want to be very clear. The leadership that we have seen, and I want to commend Senator Schumer and Speaker Pelosi. I spoke to both of them yesterday. I want to commend them for the work they are doing, because they have led the way in pushing for all the elements of the stimulus that were needed, not just for cities and states, but for everyday people. Those checks are going out to help working people. So much of that came from the leadership of Speaker Pelosi and Senator Schumer. We know where the roadblock has been consistently. Senator McConnell, the majority leader of the Senate, has stood in the way so many of the things needed. He has to hear our plea. He has to understand what it means for human beings that he's not allowing the kind of aid to flow that we need. But it's also clearly time for President Trump to speak up. I spoke to the president yesterday. I let him know what's happening in his hometown. I let him know that we're experiencing a huge budget problem, and I said it to him in the clearest terms. If we don't have any more resources, how can we provide for the safety, the protection, the health of New Yorkers? And I was clear with him and the vice president that the only way to recovery is if New York City and all our cities are able to come back strong, and if they can function. If they can't function, there is no recovery. So right now, there is an opportunity right this minute. Literally, negotiations are going on in Washington on what's being called Stimulus 3.5. There's another even bigger stimulus package up ahead, number 4, later apparently in May. But right now, there are negotiations going on Stimulus 3.5 with a focus on small business and paycheck protection. And obviously, our small businesses have gone through hell, and only the federal government can help them in the way that's needed. Working people need to know that their livelihoods will be preserved. That piece of this Stimulus 3.5 is crucial. There's a discussion right now, a proposal of $250 billion for small business and for working people through paycheck protection. There's $100 billion on the table for hospitals and healthcare workers, crucially needed here and many, many other places. And $150 billion, and I think it should be at least $150 billion. I know the governors, to their credit, the nation's governors, bipartisan consensus are calling for even more, and we need more. But right now, even to begin a discussion of $150 billion in locality aid directly to localities and states. But I got to be clear, that formula must be based on need. It must be based on what localities and states have actually experienced with COVID-19, not just some generic distribution for political purposes, but actually addressing the needs of this city, this state, what people have gone through. You know, if we were talking about a hurricane, if we were talking about natural disaster, you wouldn't put money in for the entire nation equally if the natural disaster happened in one place. This is a different reality because this disaster of COVID has happened many places. But thank God there are some parts of our nation that have had very little impact, some parts that have had moderate impact, and then a place like New York that's borne the brunt, that's been the epicenter. This funding must reflect that reality. It's just common sense. It's about helping people and about helping us back on our feet. So I made clear to the president that his hometown needs him, and I've had this conversation with him before. All New Yorkers, 8.6 million, are watching the White House right now to see if the president will lead. Will the president speak up? If the president of the United States speaks up, let's be clear, if President Trump raises his voice, the Republican Senate will follow, period. Haven't heard his voice yet. I want to give him an opportunity to do the right thing. So President Trump, here's my appeal to you. Help us back on our feet. Tell Mitch McConnell that we need Stimulus 3.5 and we need aid directly to New York City, directly to New York State, so we can keep providing the help that people need, keep them healthy, keep them safe. If you lead, the Senate will follow. If you are silent, they will not. It's on you, Mr. President. And it's true for every city and every state in America as well. So, anyone who wants that national recovery better take care of the places that have to build that recovery. And that's why we need this Stimulus 3.5. And it could be agreed to today, literally today, and passed by the Senate by unanimous consent. And that's what we need. Now, that is a very broad summary of what we are presenting today in the budget. The details have been posted publicly now, showing you how we made the difficult cuts we had to make, the specific programs and initiatives we had to cut back in this time of crisis. Some of them, thank God, many of them will be able to hopefully restore one day in better times. But so much of it is also about just the reality. A lot of what we're doing just can't happen now. Any expenditure that was related to people gathering as part of their normal year, there are no gatherings. So there's a lot you'll see in these cuts that were obvious, a lot that were difficult, of course. All that were necessary so that we could keep the resources for those basics I described. So the facts, the details are now public. How we got to the specific numbers that now dictate this budget. The toughest part will be ahead, and that will all be about what happens in Washington. And we have time, thank God, to see Washington decide if they're going to act or not, if they're going to save New York City and America's cities or not. We have time between now and June for those decisions to be made, and they better be made right. And that will dictate everything else we have to do. So that is a very broad overview of the budget. I want to talk about a few other areas, and then we will turn to questions from the media. So right now, as we fight this battle against the coronavirus, we're learning every day more and more about it, more and more about the reality. And one of the things we've talked about in the last week or two is we're seeing some real disparities in how this horrible disease is affecting our city. We're seeing some places hit particularly hard, We're seeing lower income communities hit particularly hard. We're seeing communities where people have not gotten enough health care historically hit hard. Communities of color hit very hard. Immigrant communities hit hard. So we're making additional adjustments to our approach. And one of them is to increase the number of free hotel rooms available for isolation and quarantine. Right now, 11,000 hotel rooms are being readied for this new effort. And this will be focused on people who need a place because of the reality of their living circumstance. For example, there are many people in multi-generational homes, particularly in lower income communities, that just don't have a lot of space. And if there is a threat that someone might get infected in the home and it might spread amongst the members of that family, we have to guard against that. So we are making sure that people in those multi-generational homes, many of them overcrowded homes, will have a place to go. If a member of a family, for example, is symptomatic, or if a member of a family is high risk, we will have a hotel room that will allow them to isolate from other members of the family. This is something that's going to help us protect people and slow the spread further. We'll work with community health centers and all of our public hospitals and clinics to identify who needs this particular support. This will begin this coming Wednesday, and we will move those who need that help to those hotel rooms. We're also continuing to make sure the hotel rooms are available for all healthcare workers. I want to emphasize this, whether they work in public hospitals, whether they work in any of the other types, the voluntary hospitals, the independent hospitals, any healthcare worker who needs a place to stay while they're doing their work, who needs to be isolated from their family for fear of spreading the disease to their family. And obviously these incredibly heroic healthcare workers are exposing themselves every day to that potential risk, and a lot of them do not want to take the risk of bringing it home to their families. Those hotel rooms will be available regardless of which hospital. There's 56 hospitals in this fight. Regardless of which one you work at, they will be available to you if that's what you choose. And obviously, as we discussed a few days ago, making more rooms available for homeless individuals who are in shelter settings where we need to create more space. Wherever it's not possible to have the space that we need, we're going to use hotel rooms as the better option. This is made more possible by the fact that we see the reality with coronavirus somewhat differently, affecting us somewhat differently today than it was a week or two ago. We are far from out of the woods. But bluntly, at this point, I had expected a number of these hotels to already have been converted to field hospitals. Our projections told us we might have to use a vast number of hotels, dozens and dozens, to be able to accommodate all the medical needs. So far, thank God that has not been the case. Again, we will not let our guard down. We will always be vigilant. We are never ruling out that this disease might throw us another curveball. But because there are more hotel rooms now available, we're going to turn them to these uses more and more to keep people safe. Another area where there's been a lot of concern, and understandably so, has been about our jail system. Keeping everyone safe. The people who work there, our corrections officers and all the other folks who work there, the inmates as well. There's been a real humanitarian concern. Well, what we've been devoted to from the beginning is reducing that jail population in whatever way we appropriately could, whatever way was fair and humanitarian, but also always kept public safety in mind. So at the beginning of March, there were 5,447 inmates in our jail system. And that, it bears remembering, was already less than half the number compared to the day I took office, when we had over 11,000 inmates. So beginning of March, 5,447. 3 weeks ago, we announced that we had gotten under 5,000 inmates. And yesterday, another historic milestone, jail population is now under 4,000 inmates. That is the lowest in 74 years. You have to go back to 1946, the year after World War II ended, to have had so few people in our jail system. And again, under 4,000 people compared to a city of 8.6 million. So thank God we were able to find a way to do that the right way. And that means there are many fewer people in the space that remains, more ability to socially distance within the jails, more ability to ensure that people need isolation or quarantine, they can get it. And this is how we're going to protect the health of everyone involved. And with, of course, the extraordinary efforts of our correctional health system, part of health and hospitals. And I thank everyone at Correctional Health. They don't get a lot of attention. They don't get a lot of kudos. But I want to thank everyone at Correctional Health who's been making sure that everyone in our jail system, employees and inmates, are safe. And again, to all of our correction officers and everyone who works in our correction system, we know how tough your work is, and it's been really tough in this period. But you've stuck to it, and you've all worked together to keep people safe, and we really appreciate that deeply. Now, we're at the point where each day I tell you about the indicators that tell us how we're doing, and I think you're going to see again that we should never underestimate this disease. We're hoping for sustained progress. We believe these indicators are the truest indicators to tell us where we stand and where we're going and how to approach it. But these indicators tell us a tough truth some days about the fact it won't be easy, it won't necessarily be fast, it won't be all in a straight line. So we believe this is the truth, and New Yorkers always want the blunt truth, and it tells us we've got a lot more work to do, but it's also a reminder that the progress we have made is all because of you. And stick to it with those social distancing standards and with shelter in place. Stick to it, because we're going to need it. So in terms of the daily number of people admitted to hospitals for suspected COVID-19, unfortunately that number went up. And again, these are based on numbers from 2 days ago that have been verified. Went up from 370 to 386. Daily number of people in ICUs across our health and hospital system for suspected COVID-19 went up 868 to 887. The percentage of people who tested positive went up from 53% to 55%. And our public health labs testing, the number who tested positive went up from 76% to 78%. So this was a tough day. This is not what we're looking for, but we know we're going to do this stage by stage, step by step. We'll get there. And it just reminds us we have to stick to it. So before I conclude with a few words in Spanish, I'll just say everything we've tried to do over years and years is about making people's lives better and bringing more fairness to this city. Now it is about that for sure, but it's really about four things, four basic things: your health, your safety, food on your table, a roof over your head. That's what we are going to make sure all New Yorkers have. Whatever else happens, that's what we're going to focus on. Not even a pandemic can stop us from protecting New Yorkers, and that's what we're going to do. Quickly in Spanish.
This has been a special report from CBS 2 News. We now return to our regular programming.